Hello everyone, welcome to Dentospedia, one of the best platform for dental global board exam. And today I am going to give you a short lecture from endodontic module, that is the regenerative endodontics. So let us begin with this beautiful chapter, that is regenerative endodontics. Coming to introduction, here the current endodontic therapy primarily aims to maintain the pulp health in cases of inflammation. So we already know how the current endodontic therapy works. It works by maintaining the pulp health. However, a more biologically desirable objective is the regeneration of a healthy pulp dentin complex and the management of immature permanent teeth with open apices and pulp necrosis is a significant clinical challenge, which we do now as apexification. So traditionally, such cases were treated by apexification, the management of immature permanent tooth with open apices. But recently, these regenerative endodontics procedures have emerged as valuable biological alternatives. Now, coming to see the limitation of traditional apexification. So, what are the limitations of these apexification? First, they produces only an apical calcified barrier. So, they only provide a single barrier, but not whole length of root. There is no increase of root length. There is no thickening of the dentinal walls. The tooth remains structurally weak. So even after the apexification has been done, this tooth still remains weak and there is increased risk of cervical root fracture, which is a poor prognosis. So these regenerative endodontics overcome these limitations by promoting continued root development. So here in regenerative endodontics, we can see there is closure of the apex, and also the development of the root. Now coming to concept of this regenerative endodontics, the concept involves the development of normal and sterile granulation tissue within the root canal space. So here is nothing but the concept is to grow granulation tissue, which leads to revascularization, means leads to new blood flow or nervous flow, that means the vascularization in the particular tissue, and which stimulates the cementoblast and undifferentiated mesenchymal cells at the periapex. And these cementoblast and undifferentiated mesenchymal cells, these cells, they deposit calcified tissue at the apex. So they will deposit this calcified tissue and along with the lateral dentinal wall, which resulting in normal root maturation. So these are the concepts, these are the step how it works. First, by the granulation tissue formation, which allows us the revascularization, and then due to these granulation tissue and revascularization, again when the vessels flow inside, then the cementoblast and these undifferentiated mesenchymal cells, they come into the picture, and then along with these cells, with the help of these cells, the normal root mature. Now coming to radiographic outcome, unlike calcium hydroxide or MT-induced apexification, these regenerative procedures, they demonstrate. So what we can see in the radiograph now, a progressive increase in the root length, also the thickening of the dentinal walls, apical closure, I already told you, the apex closure, and also the healing of periapical lesion. 6 years follow-up radiograph shows the biological regeneration. Very important. Now coming to components of these regenerative endodontics. Actually, the regenerative endodontics, it is successful through these 3 essential components. First is the stem cells, second is the growth factor, and third is the scaffold, which is the 3D dimension, which involves both this growth factor and the stem cells. So these cells, these components, they work together to form regenerative endodontics: stem cells, growth factors, and also scaffold. Now coming to goals of these regenerative endodontics, first primary goal is the elimination of the symptoms and obviously the healing, bony healing. Secondary symptoms, secondary goals are the increase in the root wall thickness and also the root length. So we not only want to eliminate the symptoms, which is the primary goal, but also we want to increase the root length and also thickness. And the tertiary goal is of course positive response to vitality testing. So it shows how the pulp has become, again vitality has increased, how the pulp has become vital. So tertiary goal is to positive response to the vitality test, and these are the goals of regenerative endodontics. So thank you everyone. I hope you understood this short lecture. To understand the entire lecture with complete explanation, flowcharts, diagram and based MCQs, please download the Dentospedia app today. Thank you.